Well, let's try this again. The personal freedoms debate over mask wearing is similar to the seatbelt debate of the 1980s. South Dakota was one of the last states to adopt a seatbelt law in the early 90s. There's no doubt that seatbelts save lives, and now science tells us so do masks. In tonight's edition of COVID-19 Beyond the Numbers, we look at the reasons to wear a mask.
Wear a dang mask.
Some local politicians are now pleading with the public to wear masks to help slow the spread of COVID-19. But getting some people to do that may be next to impossible. Earlier this year, doctors were not recommending the general public wear masks because there weren't enough available for medical staff. It was also before they had data on mask effectiveness.
Most of the studies that I see kind of range somewhere between 50 to 90% effective. If I told you that I had a vaccine just came on the market today that was 60, 70, or even 90% effective at preventing COVID, you'd be beating down my door to get it.
While the public can't agree on mask effectiveness, neither can Sioux Falls' own hospital systems.
Are masks 70% effective? Is that right?
I'm not aware of that.
Okay, that's the number I've heard from medical professionals.
I haven't heard that.
But wouldn't you want to tell people to wear masks so that you can keep your capacity low?
If policymakers want to make policy, that's what they're elected to do, that's fine. We're going to endorse CDC guidance, which we have, and we certainly endorse masking as appropriate per CDC guidance.
This week, both Sanford and Avera did back the mayor's plan to wear masks to stop our hospitals from being overwhelmed. Avera says it sees firsthand that masks work to stop the spread.
And it's almost unheard of for a healthcare worker to get COVID from their patient or for one healthcare worker to give it to another. The only times that we see that happen, it is in the break room when you take the mask off.
Doctors also warned that we shouldn't be hoping for herd immunity from COVID-19, that doing nothing to help stop the virus would be catastrophic.
To get the herd immunity, which is probably up near 60%, that's going to be another 10 times as many infections as we've seen now. Our hospitals cannot handle 10 times the infections we're seeing right now, and we certainly can't handle 10 times the deaths of what we're seeing right now. So we can't count on herd immunity being the answer.
Dr. Basil says he is especially concerned as it gets colder and even small gatherings move indoors. He says that while it may not be ideal, until we have a vaccine, people need to be wearing masks inside at any social gatherings or think of alternative ways to socialize.